Neural tube defects, NTDs, which are birth defects that affect the brain, spinal cord, or the coverings of these organs. These defects occur very early in pregnancy, typically within the first month, often before a woman even knows she's pregnant. Here's how neural tube defects can occur during pregnancy. 1. Failure of neural tube closure. The neural tube is a structure in the developing embryo that eventually forms the brain and spinal cord. NTDs happen when this tube doesn't close completely. There are two main types of NTDs. Spina bifida occurs when the spinal cord doesn't close completely. Anencephaly occurs when the upper part of the neural tube doesn't close, resulting in significant brain malformation. To folic acid deficiency, the most well-established risk factor for NTDs is inadequate folic acid. Vitamin B9 intake before and during early pregnancy. Folic acid is crucial for the proper development of the neural tube. 3. Genetic factors. Genes play a role in NTDs, although most cases don't follow a clear inheritance pattern. Having a family history of NTDs increases the risk. Certain genetic syndromes can also increase the risk. 4. Certain medications. Some medications taken during pregnancy have been linked to an increased risk of NTDs. These include certain anti-seizure medications, e.g., valproic acid, carbamazepine, and some medications used to treat acne isotretinoin. 5. Maternal health conditions. Certain maternal health conditions, such as diabetes. Uncontrolled diabetes during pregnancy increases the risk of NTDs. Obesity. Maternal obesity is also associated with an increased risk. Maternal hyperthermia, elevated maternal body temperature, fever, or hot tub use in early pregnancy has been associated with an increased risk. 6. Environmental factors. Exposure to certain environmental toxins or chemicals during pregnancy might play a role, but the evidence isn't as strong as for folic acid or medications. Important considerations. Timing. NTDs occur very early in pregnancy, weeks 3 to 4 after conception. Therefore, taking preventive measures like folic acid supplementation before conception is crucial. Prevention. Most NTDs can be prevented by adequate folic acid intake, the Centers for Disease Control and Prevention, CDC, recommends that all women of reproductive age take 400 micrograms mcg of folic acid daily. Women who have had a previous pregnancy affected by an NTD may need a higher dose. Prenatal screening. NTDs can often be detected during prenatal screening tests, such as maternal serum alpha-fetoprotein MSAFP screening, a blood test done during the second trimester. Ultrasound can visualize the fetal spine and brain to detect some NTDs. Amniocentesis, a procedure where a sample of amniotic fluid is taken for testing. It's vital that pregnant women, or those planning to become pregnant, consult with their healthcare provider about folic acid supplementation, any medications they are taking, and any pre-existing health conditions. Early prenatal care is crucial for identifying and managing potential risks. Subscribe my channel.